Hi, and welcome back to the Pro PA podcast. I'm Angie Urbina, your host for the dermatology section of this series. In this episode, we are diving into folliculitis, a condition that you'll see often, whether you're in primary care, dermatology, or urgent care. If you're preparing for the PANCE or managing patients in clinic, this episode is just for you. Let's jump in. All right, so what is folliculitis? Essentially, it's inflammation of the hair follicles, which can involve either the superficial or deep portions of the hair follicle. The most common culprit is Staphylococcus aureus, but it's important to note that folliculitis can also be caused by fungi, viruses, or even parasites. And here's a fun fact. If your patient just came back from a hot tub party and shows up with folliculitis, you're likely dealing with Pseudomonas aeruginosa, the bug behind hot tub folliculitis. Now, let's talk about who gets folliculitis. Honestly, just about anyone. But some people are more at risk. Shaving, wearing occlusive clothing, sweating a lot, or being immunosuppressed can increase susceptibility. And of course, don't forget to ask about hot tubs, always a key detail in the history. Here's what you're looking for: erythematous, perifollicular papules or pustules. These are usually centered around a hair follicle and can show up in any hair-bearing skin. Patients may complain of itching or tenderness depending on the severity. And as far as hot tub folliculitis, look for small pustules that appear 1 to 4 days after hot tub use, often in areas covered by swimwear. Now, if this sounds like acne, it's a reasonable thought, but remember, folliculitis does not involve comedones. All right, so you've got your clinical suspicion. What's next? In most cases, you don't need any labs. Diagnosis is clinical. But if the folliculitis is recurrent, refractory, or you're suspecting MRSA, which is your methicillin-resistant Staph aureus, then go ahead and get a bacterial culture to guide your treatment. Cultures are also useful for those rare cases of gram-negative folliculitis. Let's move into how we manage this. Treatment depends on the severity and the cause. For mild cases, a topical antibiotic like mupirocin or clindamycin are the treatment of choice. However, it is important to know that some cases can actually resolve without any antibiotics, and good skin hygiene and antibacterial soap or benzoyl peroxide can be recommended. For more extensive or recurrent cases, oral antibiotics for Staph aureus, such as dicloxacillin or cephalexin, are the indicated treatment. And if you're worried about MRSA, again, this is your methicillin-resistant Staph aureus, you would want to give something like doxycycline, Bactrim, or clindamycin. When it comes to hot tub folliculitis, remember, ciprofloxacin is the drug of choice for Pseudomonas. Now, here's a quick management tip. If the folliculitis isn't responding, consider fungal causes and treat with a topical or systemic antifungal. Prevention is key, especially for patients prone to recurrent folliculitis. Recommend antibacterial soap and encourage good hygiene. Also, you want to recommend avoidance of tight clothing or anything that might trap sweat and heat. And for those hot tub lovers, remind them about proper water maintenance to avoid Pseudomonas. Speaking of complications, while most cases are straightforward, you want to keep an eye out for furuncles or carbuncles, which involve deeper infections, and also scarring or post-inflammatory hyperpigmentation in severe or chronic cases. All right, so here is a quick clinical pearl. It is a mnemonic for folliculitis causes. The mnemonic is BUMP, B-U-M-P. B for bacteria, U for unsanitized hot tubs, which would be your Pseudomonas, M for molds and fungi, and P for parasites and viruses. Let's wrap up with a couple of questions to test your knowledge. Question 1. A 35-year-old man presents with pruritic, erythematous, perifollicular pustules on his chest and back 3 days after using a hot tub. What is the most likely diagnosis? Is it A. Acne vulgaris, B. Staphylococcal folliculitis, C. Hot tub folliculitis, or D. Fungal folliculitis? I'll give you a second. If you answered C. Hot tub folliculitis, you are correct. This patient is presenting with folliculitis 3 days after history of hot tub use. This leads us to think of hot tub folliculitis and Pseudomonas as the culprit. Question 2. A 25-year-old woman presents with localized folliculitis on her thighs after shaving. What is the most appropriate initial treatment? Is it A. Oral doxycycline, B. Topical mupirocin, C. Antibacterial soap only, or D. Oral cephalexin? If you chose B. Topical mupirocin, you are correct. The patient is presenting with a mild case of folliculitis localized to her thigh. Therefore, the first-line treatment is topical mupirocin. Thank you for tuning in to the Pro PA podcast. Don't forget to hit subscribe and turn on notifications so you never miss an episode. And look out for future episodes in our dermatology series, where we'll cover more high-yield topics to help you ace the PANCE and thrive in clinic. And remember, this is the Pro PA podcast, where future pros in medicine are made. Catch you next time.